Hi, everyone. This is a short example of the assignment that we're going to work on this week. So this week we're working on hip flints, which is history, inspection, palpation, ligament test, neurologic test, and special tests. So there's an order to doing an evaluation to figure out what's wrong. So you guys have a good understanding of the anatomy. You also now understand the injuries that happen with the low leg and ankle. And so now we're going to have you work through an evaluation process, at least sort of. It's going to be a two-part assignment. The first video, you're going to do history, inspection, palpation. And the second video, you're going to do the last four. So today I'm just going to show you the first part. So history, inspection, and palpation. So when an athlete comes in, you have to ask them questions to get them to tell you the story of the injury. So for the video that you're going to record, you're going to ask 3 to 4, and I'll give you a list so that you know what to include on your video for sure. But you would ask 3 to 4 questions of the athlete. So for example, how did you hurt yourself? When did it happen? Where is the pain? And that's probably the one that I'm going to make everyone do is you're going to say where the pain is. So when you're doing these little mock video evaluations, you're going to decide what the injury is, if you will. So if it's an anterior talofibular, the athlete would have told you that the injury is in the lateral side of their ankle, or they would point to that, and you can actually have that accomplished in your video. So for your video, you're going to need a dummy. You could do this on yourself, but it's not going to be very easy. You're going to have to figure out a way to set up a video camera, your iPad leaning against something so that you can hit record. So that's going to take a little bit of effort on the first one. So anyways, this is going to kind of walk you through that. So history, you're going to cover a few questions of that. Next, you're going to look at inspection and then palpation. So I'm using Mrs. Sand's leg here. I'm going to tip the camera so that you can see her leg, and we'll kind of talk through that, if you will. So here's kind of what your video assignment will look like. So here we go. We got a leg. So history, first thing you're going to ask is when did the injury happen? And so like you're going to kind of walk through that. You could have the athlete or your partner that's helping you do the video say the answers, or you could just make it up as you go. So if I said, this is a basketball athlete that just walked into the athletic training room after stepping on somebody's foot and rolling their ankle, and they're complaining of pain on the lateral side of the ankle, you would just point to it and kind of explain what that is. So you would go through history, just tell me a brief story that you would have got from the athlete through the questions. Next, you would do inspections. So I want you to talk through what you would look for. And you could either point and show it and or just describe it. So the athlete walked into the athletic training room with a slight limp. They were able to climb up onto the table and get their shoe and sock off with some pain, but not a lot of pain. When you asked where they pointed to for pain, they pointed to the outside lateral side. So as I look at the ankle, it looks normal to me. You can see the malleolus. You can see the fibula coming down. There doesn't appear to be any massive swelling. There's no discoloration. There's no bruising. When I look at both ankles bilaterally, they look similar in size. I don't see anything different between the two. So those start to get me to think about that it's not necessarily a super bad injury. History, inspection. The third one for this first video is palpation. So I'm going to run through a lot of palpation things. You won't have to include all of them. I'll give you a list of what you have to include. And this kind of goes back to the anatomy, and this is a good kind of review of anatomy anyways. So when we palpate, the first thing we look for is bones. So if I'm dealing with an ankle, the first thing I'm going to do is I'm going to palpate the fibula. I know the pain is down here. I'm going to start superior to that. I'm going to feel the fibular head up all the way by the knee. I'm going to follow the fibula down with my fingers all the way down, and then you can find it just above the lateral malleolus. You have to be careful if you're thinking lateral ankle sprain not to push super tight or super hard, but you can actually feel the whole bottom part of the lateral malleolus. Okay, I then go over the tibia as well, travel down the tibia. You can feel the shin on the anterior side really well. Go all the way down and you can feel the whole side of the medial malleolus. Okay, usually then I'll palpate both of them and actually put some pressure and squeeze both bones just to see if there's any issues. Okay. Next, I would palpate calcaneus, okay, and talus. And I probably would go down to cuboid, base of the fifth, possibly the navicular on the medial side, and then you can even palpate all 5 metatarsals. Okay. Again, concentrating on where your injury is at. For the video, you guys are going to get to pick medial or lateral side. So concentrate on the lateral side or concentrate on the medial side, depending on what you want for your video. Okay. Next, we go to ligaments. So I'm actually going to palpate. Here's the tip of the lateral malleolus. If you remember from the ligament assignment, your anterior talofibular is going to be right here. Your calcaneal fibula is going to be right here, and your posterior talofibular is going to be right here. Okay. If we move it over to the deltoid side, here's the tibial, the medial malleolus. Okay. Tibiocalcaneal is going to go straight down. Tibial navicular is going to go down here. You can see there's a navicular tubercle when we did that. Okay. Tibial, anterior tibial talar, posterior tibial talar, and then we also can palpate the anterior inferior tib fib, or the high ankle sprain, as well. So last is muscles. Let's just talk through muscles real quick. When you palpate muscles, you want to think about compartments. The biggest compartment is going to be the gastroc soleus. If you go way up by the knee, you're going to be able to feel the gastrocs really easily. Remember, as you go down, actually plantar flex a little bit. Plantar flex. Okay, you can see the gastroc, and you can actually see how the soleus pops out, and then there's the soleus. You can see the gastroc. So you can tell when you're palpating the gastroc and when you're palpating the soleus. Okay. Next, if we go to lateral compartment, if we have her resist into eversion, you can see the peroneus longus and brevis tendons popping out. And if you pay attention to it, you can actually see them travel down here. So you can follow that tendon, go all the way down. Remember, peroneus longus attaches up high, peroneus brevis attaches low, and so you can differentiate between the pain. Okay? I also would go really close to the base of the fifth. If you're having pain right down there, then you're going to worry about a Jones fracture, or possibly the brevis versus the longus, which travels underneath. Okay. If we go to anterior compartment, you can already see, okay, extensor digitorum. All four of those tendons go up, and if I have Mrs. Sand pull up, you can see on some people more than others, they'll actually turn into one tendon right there. Okay. On a few people, you might be able to see the tendon of the peroneus tertius, and I'm not put evert a little too. I can feel it. It's right there, but you can't see it. Some people can actually see that pop up. Okay. Extensor hallucis, you can see that tendon pop up here as well, and you can follow that tendon up. Okay. And then tib anterior, big one up on the shin. Okay. Dorsiflex again and invert. And you can follow that tendon all the way down to where it attaches to the first, right there. You can actually grab that tendon really easily on everybody. So there's your tib anterior, attaches down to the first cuneiform and the first metatarsal. Okay. The medial compartment is not very easy to palpate. You cannot see those tendons. Okay. Remember Tom, Dick, and Harry. So tibialis posterior is close to the medial malleolus. Then it goes digitorum, and then it goes hallucis. They run deep, and they travel underneath the medial malleolus, and they go into the arch. So you can actually, you can kind of palpate where they're at, but you can't tell which one you're on. You just have to kind of use them all together as a whole. Okay. So that's palpation in a nutshell. So this is just to give you an idea as to how to do it. I will have a nice long list of all the things you have to cover in your video. There'll be 3 to 4 things with history, 3 to 4 things with inspection, and 3 to 4 things with palpation. You're going to pick a medial side or a lateral side ankle and do all of it. So you'll be able to set up your camera to show one side, so you don't have to flip back and forth like I did. So that'll be your choice if you want to cover medial side or lateral side. Okay. Make sure you let me know if you have questions, if you're having a hard time with this video assignment, so that I can give you some help.